interventions in the pre-conceptional period. Undernourished women need probably intervention, nutritional intervention, other interventions to have a bigger chance to have a baby which is not very small. When should this intervention start and what kind of intervention would you recommend?
So this is an important question, and a question for which we do not necessarily have all the elements in place to give you a very definitive answer. But here is what we know, and here is what we don't know. So what we know is for a large proportion of countries in low and middle income situations, where women have a disproportionately high burden of undernutrition, wasting or micronutrient deficiencies, to address those effectively for better birth outcomes in pregnancy is probably too late. Because number one, they present late, generally after the first trimester. Secondly, the ability to get a reasonable amount of a dose effect response by getting sufficient micronutrients or balanced energy protein or even calcium supplements, all of those have limitations of effectiveness. They can have an effect, they do, but it's not optimal. So when does one start? And how quickly or earlier than pregnancy does one start? The jury is out. There have been very few evaluations of preconceptional nutrition interventions. What we know indicates the earlier you start, the better.
Well, if you address this, you start during adolescence perhaps. Wouldn't it be better to start at the school age?
Well, I think it depends upon resources within countries. So if you're dealing with a very limited fiscal resource and a limitation of access to populations, if a large proportion of girls drop out of schools and they're not in a delivery platform where you can access them through schools, then clearly accessing them at an early stage for prevention, promotion with school nutrition programs, with deworming programs, with effective interventions to reduce anemia in that population, that makes a lot of sense. And I think what we are now asking for is that with all the focus that we have on under 5 child health and nutrition, largely focused on survival, once you go beyond that age group, you need interventions that are focused on things that go beyond survival, that go on development, on reducing morbidity, on improving life trajectories and birth preparedness eventually. So there is a continuum of care between what we call childhood, adolescence, young adults, and motherhood. And that's what we need to develop as a society.
Last question, is there any country in the developing or emerging countries which has shown that it could work?
Absolutely.
Yeah.
Absolutely. So countries that have been able to eliminate the burden of intrauterine growth retardation, maternal morbidity, mortality, and reduce stunting within a generation. Remarkable examples of countries like Brazil, countries like Chile, countries like China, where there's been such a secular trend and change in a reasonably short period of time, indicate that it can be done. Now, the question is, how was it done? Was it all done through nutrition? The answer is no.
Just a bit.
It's basically improvement in living standards, environmental health, lot of investment in water sanitation, hygiene to reduce early onset infection and impact on intestinal health, interventions to reduce family size, family planning, improving health, nutrition, education for girls. So holistic investments in economic development, social development, and a particular focus on health and nutrition at a population. That's how countries have done it.
Okay, thank you very much. Let's hope that many countries will do it.